Hey everyone, and welcome back to the channel. Today, we're re-diving into a topic that is pretty fascinating, but not often talked about. What exactly happens to the uterus during those intimate moments? It's a part of our anatomy that plays a huge role in life, but its functions beyond pregnancy are often a mystery. So let's pull back the curtain and explore the amazing ways the body responds to intimacy. First off, let's get a clear picture of the uterus. Think of it as a small, pear-shaped muscular organ nestled deep in the pelvis between the bladder and the rectum. Normally, it's about the size of a fist. Its main job, as we all know, is to nurture a developing fetus during pregnancy. But its activity isn't limited to just that 9-month period. The uterus is dynamic and responsive, and this is especially true during sexual arousal and climax. So, what kicks things off? When a woman becomes aroused, the body's response system goes into high gear. Blood flow increases dramatically to the entire pelvic region. This is what causes the clitoris and labia to swell, a process known as vasocongestion. But this increased blood flow doesn't stop there. It also affects the internal organs, including the uterus. The uterus starts to swell and lift, moving up and away from the vaginal canal. This movement is actually pretty clever. It's part of a process called tenting. As the uterus lifts, it pulls the cervix upward, which in turn lengthens and expands the upper 2/3 of the vaginal canal. This creates more space, making intercourse more comfortable and less likely to cause discomfort from the cervix being bumped. It's like the body is literally making room, preparing itself for intimacy. This tenting effect is a key part of the female arousal response. Now, let's talk about what happens during the peak of the experience. The orgasm. This is where the uterus really puts on a show. During an orgasm, the muscles of the pelvic floor, including the walls of the vagina and the uterus itself, begin to contract rhythmically. These contractions are involuntary, meaning you don't consciously control them. They typically occur in waves, starting intensely and then gradually becoming weaker and less frequent. What's the purpose of these uterine contractions? Well, there are a few theories. One popular idea is that they help transport sperm toward the fallopian tubes, potentially increasing the chances of conception. The contractions create a sort of wave-like motion that could guide sperm in the right direction. It's like the uterus is giving them a helpful push on their journey. Another theory is that these contractions simply serve to release the built-up muscular tension and blood congestion from the arousal phase, leading to that feeling of release and relaxation that follows an orgasm. It's also important to note that the intensity and even the presence of these contractions can vary greatly from person to person, and even from one experience to another. Some women may feel them very strongly, while others might not notice them at all. And that's completely normal. Everyone's body responds differently, and there's a wide spectrum of what constitutes a normal and healthy response. The experience of pleasure is unique to each individual. So, after all the excitement, What happens during the resolution phase? As the body returns to its pre-arousal state, everything goes back to its original position. The blood that had rushed to the pelvic area recedes, the swelling goes down, and the uterus descends back to its usual resting spot in the pelvis. The tenting effect reverses, and the vaginal canal returns to its normal size. This whole process can take anywhere from a few minutes to half an hour. Understanding these internal mechanics can be really empowering. It's a reminder of just how complex and wonderfully designed our bodies are, far from being a passive organ that just waits for pregnancy. The uterus is an active participant in sexual response, moving, expanding, and contracting in a beautifully orchestrated dance. Knowing what is happening inside can deepen our appreciation for our bodies and demystify processes that are a natural part of human sexuality. I hope this has been an insightful look into the secret life of the uterus. It's a topic that deserves more open conversation. If you found this video helpful or interesting, please give it a thumbs up and consider subscribing for more content about health and the human body. As always, thanks for watching, and I'll see you in the next video.